Thank you very much for coming to my channel again. If you are new to the channel, subscribe to our channel and become a family. Thank you, 11 Proven. Health benefits of ginger may have numerous health benefits due to its anti-inflammatory, anti-nausea, and other properties. It may help you lose weight, manage arthritis, reduce menstrual symptoms, and more. Ginger comes from a flowering plant originating in Southeast Asia. It adds flavor to sweet and savory foods and has a range of health benefits. It belongs to the Zingiberaceae family, and it's closely related to turmeric, cardamom, and galangal. The rhizome, underground part of the stem, is the part commonly used as a spice. It's often called ginger root or simply ginger. You can use ginger fresh, dried, powdered, or as an oil or juice. It features in many recipes as well as processed foods, home remedies, and cosmetics. What are 11 health benefits of ginger? 1. Contains gingerol, which has potent medicinal properties. Ginger has a long history of use in various forms of traditional and alternative medicine. It's been used to aid digestion, reduce nausea, and help fight the flu and common cold, to name a few of its purposes. The unique fragrance and flavor of ginger come from its natural oils, the most important of which is gingerol. Gingerol is the main bioactive compound in ginger. It's responsible for many of ginger's medicinal properties. Gingerol has powerful anti-inflammatory and antioxidant effects, according to research-trusted source. For instance, it may help reduce oxidative stress, which results from having too many free radicals in the body. 2. Can treat morning sickness and other forms of nausea. Ginger may be effective trusted source against nausea, including pregnancy-related nausea, commonly known as morning sickness. Ginger may help relieve nausea and vomiting for people undergoing certain types of surgery, and it may also help reduce chemotherapy-related nausea. While generally safe, it's best to talk with a doctor before taking large amounts if you're pregnant. Ginger may not be suitable trusted source during pregnancy for people who are close to labor and those with a history of pregnancy loss or vaginal bleeding. It may also be unsuitable for those with clotting disorders. 3. May help with weight loss. Ginger may play a role in weight loss, according to studies in humans and animals. 1. 2019 Review Trusted Source concluded that ginger supplementation significantly reduced body weight, the waist-hip ratio, and the hip ratio in people with overweight or obesity. Ginger's ability to influence weight loss may be due to certain mechanisms, such as its potential to reduce inflammation. 4. Can help with osteoarthritis. Osteoarthritis, OA, involves degeneration of the joints, leading to symptoms such as joint pain and stiffness. One review concluded that ginger may help reduce pain and disability. The participants took 0.5 to 1 gram of ginger per day for 3 to 12 weeks, depending on the study. Most had a diagnosis of osteoarthritis of the knee. However, other research-trusted source has not found evidence of the same effects. However, many discontinued treatment as they did not like the taste of ginger or because it upset their stomach. 5. May lower blood sugar and improve heart disease risk factors. Some research suggests ginger may have anti-diabetic properties. In a 2015 study trusted source, 41 people with type 2 diabetes took 2 grams of ginger powder per day. A 2022 review trusted source found a significant reduction in fasting blood sugar and HbA1c in people with type 2 diabetes after taking ginger supplements. The review looked at results from 10 trials, in which participants took 1,200 to 3,000 milligrams per day for 8 to 13 weeks. The results did not suggest that ginger supplements affected the lipid profile. A high apolipoprotein B to apolipoprotein AI ratio and high levels of molondialdehyde, MDA, can result from oxidative stress, a byproduct of oxidative stress. They are both risk factors for heart disease. However, this was one small study, and more research is needed to confirm these results. A 2019 review also found evidence that ginger can reduce HbA1c in people with type 2 diabetes, but the authors did not conclude that it can lower fasting blood sugar levels. 6. Can help treat chronic indigestion. Ginger may help manage indigestion by speeding up the passage of food through the stomach. Functional dyspepsia is when a person has indigestion, with symptoms such as abdominal pain, bloating, feeling too full, belching, and nausea, for no clear reason. It often occurs with irritable bowel syndrome, IBS. In one study, scientists' trusted source found that consuming a ginger and artichoke preparation before eating a main meal significantly improved the symptoms of indigestion in people with functional dyspepsia compared with taking a placebo. 7. May reduce menstrual pain. Ginger may help relieve dysmenorrhea, also known as menstrual pain. Some research has suggested that ginger is as effective as acetaminophen, caffeine, ibuprofen, Novofen in relieving menstrual pain. However, more studies are needed. 8. May help lower cholesterol levels. High levels of LDL, bad cholesterol, are linked to trusted source and increased risk of heart disease. In a 2022 review, trusted source of 26 trials, researchers found that ginger consumption significantly reduced triglycerides and LDL cholesterol while increasing HDL cholesterol. Even doses less than 1,500 milligrams per day were effective. However, it may be hard to include such high doses of ginger in your diet, particularly if you don't like the taste of ginger. 9. May help reduce cancer risk. Ginger may have anti-cancer properties due to gingerol and various other antioxidant and anti-inflammatory compounds. There is some evidence-trusted source that these compounds may help reduce the risk of gastrointestinal cancers, such as trusted source colorectal, pancreatic, and liver cancer. In one study, trusted source, 20 people with a high risk of colorectal cancer took 2 grams of ginger daily for 28 days. At the end of the study, the lining of the participants' intestines showed fewer cancer-like changes than expected. However, most studies relating to ginger and cancer risk have not involved humans. 10. May improve brain function and protect against Alzheimer's disease. Some research-trusted source suggests that 6-shogol and 6-gingerol, compounds in ginger, may help prevent degenerative diseases such as Alzheimer's, Parkinson's disease, and multiple sclerosis. Oxidative stress and chronic inflammation may be key drivers of Alzheimer's disease and age-related cognitive decline. Some animal studies' trusted source suggests the antioxidants and bioactive compounds in ginger can inhibit inflammatory responses that occur in the brain. This may help prevent cognitive decline. 11. Can help fight infections. Ginger's antimicrobial properties could make it useful for fighting bacterial and fungal infections. Laboratory studies have found it may be effective against Staphylococcus aureus, S. aureus, which is responsible for a range of diseases, Escherichia coli, E. coli, a cause of intestinal infections, Candida albicans, C. albicans, which causes fungal infections in the mouth, vagina, and so on. However, more studies are needed. How can ginger help with a sore throat? Risks and side effects. Ginger is safe for most people to consume in moderation. In large doses, however, it can cause trusted source the following symptoms in some people: abdominal discomfort, heartburn, diarrhea, mouth and throat irritation. It is likely safe during pregnancy and breastfeeding, but it is best to speak with a healthcare professional first. Thank you very much for coming to my channel again. If you are new to the channel, subscribe to our channel and become a family. Thank you.